I'm Rudy Evonich. I'm one of the cardiac electrophysiologists or heart rhythm doctors here at Bellin. I see a whole spectrum of folks from teenagers who have supraventricular tachycardia to 99-year-old people who have slow heart rates and need a pacemaker. I pretty much draw every patient a picture of the heart and explain the heart's electrical system and explain where their heart rhythm problem originates and what the implications of that heart rhythm problem are, why we care about it, and then what the different treatment options are. I'm from Manistee in the Upper Peninsula of Michigan, and in my small town, if you were involved in science, it was either science teacher or physician. And so in 4th grade, I decided I was going to be a doctor. Went to Alma College for undergraduate training in Lower Michigan, and then Michigan State for medical school and my internal medicine residency, and then William Beaumont Hospital in Royal Oak for my cardiology fellowship and cardiac electrophysiology fellowship. Every patient is different, and tailoring the right treatment for the right patient requires a lot of time and effort and energy, and getting to know the patient and working with them on what the right path forward for them is. And so when I see somebody in the office for a new patient visit, it's usually 45 minutes or an hour. It's not a 15-minute visit, because the rhythm problems I treat are oftentimes complicated. There's lots of contributing factors. We have to talk about those things and then pick what the right next step is for them, and there's many different treatment options available. It's kind of a team effort. I'm not going to do something that's going to fix them. They need to help themselves as well. And so, for instance, the most common rhythm problem I treat is called atrial fibrillation, and I can do a catheter ablation and do it very, very well, but if they go home and aren't treating their sleep apnea, or they are 100 pounds overweight and they come back 150 pounds overweight, it's not going to work. And so they have to be doing their part, and so we have to develop kind of a relationship where we're on the same team helping them get better. Sometimes people come back not knowing how bad they had felt. Oftentimes I see people back after their procedure and they can do things they couldn't do before. They can go hunting or fishing, they can play with their grandkids, they can go on walks with their spouse, and previously they weren't able to do that because of their heart rhythm problems, and so that's very satisfying.